Welcome to the St. Luke's Health Talk series, where we bring virtual live opportunities to you, our community members. If you want to find additional offerings, please go to www.stlukesonline.org/health talks. I'm Sarah Hagerly, St. Luke's Community Health Program Coordinator, and I'm here to share a few items. Here's our disclaimer. The information in our video, oops, I'm a little bit off. Sorry about that. The information in this video should not be construed as medical advice. This is property of St. Luke's and will be made available to you for educational purposes. And we'll go back a slide and talk about housekeeping today. You are able to participate and ask questions through a Q&A chat function. Typically, it's on the right side of your screen. You can click the Q&A icon. Ask your question. To ask your question, type your question and click on the airplane to send. And please feel free to type in your questions throughout our presentation, and we will answer them at the end. And moderators will also be able to post comments or answer questions if you have those. Today, I'm very excited to learn about our topic. Our health talk is called The Role of Physical Activity on Mental Health with Monique Middlekauf. Monique is the manager of our lifestyle medicine in Magic Valley and has a doctorate in exercise physiology. Very excited to have you. Welcome, Monique.
Sarah, thank you so much for your introduction and thank you for having me today. I'm really excited to dive right into this topic and to talk about physical activity and how it can impact our mental health. I know that we've had a lot of conversations as a nation and even as a state around the topic of mental health. And yesterday was World Mental Health Day. So we recently had an opportunity just to bring some awareness and draw our attention to our mental health. So today I do want to just kind of draw our attention quickly to what we're hoping to accomplish over the next hour. So first, I want to define mental health and review some of the most commonly used diagnoses for mental illness. I also just briefly want to talk about the magnitude of the problem so that we have an understanding of what we're dealing with. Especially for me, it helps to review some statistics and to understand how prevalent this is, who it's impacting, and what that looks like for us, maybe even personally. I'd like to review physical activity and exercise recommendations and to discuss the effect of physical activity on mental health. So specifically, I'm going to touch on three areas: the benefits and the limitations of exercise. I also want to talk about the minimum dose needed and the upper limit of effectiveness. The last thing I want to talk about is the practical steps of engaging in physical activity, maybe especially for those who might be feeling anxious or having symptoms of depression. Now, we know that mental health and physical health are inextricably connected, and physical health is much less stigmatized than mental health. And ultimately, we know that they work in very similar ways, that you can have very good mental health, or you can have very poor mental health in a very similar way that you could have very good or very poor physical health. And you can also have kind of a difference between having poor general overall health and having illness in some way. So if we're just looking at the ways to define or describe it, we would say that mental health is an important part of overall health and well-being. Mental health includes the emotional, psychological, and social well-being of a person. It affects how we think, how we feel, how we act. And it also helps to determine how we handle stress or environmental exposure, how we relate to others, and how we make healthy choices. We know that mental health is important at every stage of life, from childhood, adolescence to adulthood. It's so important. So it's more than just having feelings of happiness or sadness. It's very interconnected, and we know that it's so connected to our physical health. Now, when we look at the broad scope of mental health, mental wellness, or mental illness, it's gigantic in a very similar way that physical health is. There are so many aspects and so many facets, and there's just no possible way today that I could spend an hour with you and touch on every single aspect. So there is a significant amount of literature that's available, and I just wanted to briefly draw your attention to that. So if you're looking for additional information that you can go back to reliable resources, there's wonderful statistics found on the National Institutes of Health. You can click, I just grabbed a screenshot so that you could see, you can click on any one of these items and find out substantial amounts of information that might really benefit you or someone that you love. So today, what I did want to focus my attention on that might be the most helpful is to see what are we experiencing as a nation, maybe that most commonly used ICD-10 codes. And we see kind of a recurring pattern, which is why I chose the two items that I focused on. So the first one, the most commonly used code is generalized anxiety disorder, followed by a depressive episode, followed by recurrent depressive disorder, followed by bipolar affective disorder, disturbance of activity and attention, childhood autism, recurrent depressive disorder, all the way down to kind of other areas that I'm not going to focus on today. So my two areas that I want to focus on in our talk today are depression and anxiety. That's where we want to stay today, but we do know that there's such a broad scope. So let's first pause on the two that we're going to come back to, but let's first just talk about what causes mental illness. Well, we know there's not a single cause. There's no single cause. And there's many factors that can contribute risk for mental illness, just as there are many factors that can contribute to risk of physical illness, such as early adverse life experiences. So having trauma or history of abuse, which might be something like child abuse, sexual assault, witnessing violence, that can be very traumatic and very difficult to navigate. Experiences related to other ongoing chronic medical conditions, that might be something like COPD, cancer, or diabetes. Those diagnoses can be very hard to navigate, and they often have associated anxiety or depression that can be concurrent. We also know that biological factors or chemical imbalances in the brain can be a risk for mental illness, as well as abuse of alcohol or other drugs, feelings of loneliness or isolation, and then sedentary behavior or physical inactivity can be a risk. Now, we typically classify mental illness on a severity scale, and this might be discussing more of the symptom severity. So we might have something that could be mild. So maybe a mild mental health problem would be someone that's experiencing a small amount of symptoms, and it has a limited effect on their daily life, but it does have an effect. A moderate mental health concern might be when someone has more symptoms that can make their daily life much more difficult than usual. They're thinking about it frequently throughout the day. It's becoming more of a burden. And then a severe mental health problem is when someone has many symptoms that makes their day very, very difficult to manage. And this might change throughout time, so that it's not typically something that one person can experience just a moderate mental concern at one point, and then that's it. It can often ebb and flow throughout days, weeks, months, and years. So let's just look at the magnitude of the problem, just particularly focusing first on any mental illness, and then let's talk about depression and anxiety. So if we just look at the past year prevalence of any mental illness among US adults, and this data was taken from the year 2020. Now you can go online and find this at any time. It's widely available through nih.gov. Now, if we go to the overall, I kind of highlighted with our big yellow arrow, looking at the overall percent, we're seeing over the past year prevalence, 21% of US adults reported they were experiencing mental illness. And the highest bracket of this was experienced in those who were 18 to 25. 30.6% were experiencing mental illness, which is really high. But now let's break that into just a little bit different way to look at this. Let's look at first anxiety disorder, and then we'll look at major depressive disorder. So if we're looking at anxiety, this is different years. So we're looking at 2001 to 2003. So I just want to highlight the difference in years. So this might have changed with more recent data. But we see overall 19.1% of approximately 40 million Americans adults were experiencing any anxiety disorder. And if we're just trying to use some definitions to help make sure that we're kind of using the same language, general anxiety disorder is characterized by excessive anxiety and worry. This isn't the thing that you're just kind of feeling about anxious, maybe about an event you have to go to, or something that could be, just like a one-time, one deal. This is excessive anxiety and excessive worry about a variety of events or activities, which might be something like school or work performance, that occurs more days than not for at least 6 months. People with generalized anxiety disorder find it difficult to control their worry, can often have ruminating thoughts, and this could cause impairment in social, occupational, and other areas of functioning. Now, we see that approximately 2.7 of US adults had generalized anxiety disorder in the past year. And past year prevalence of generalized anxiety disorder was higher for females than it was for males. And approximately 5.7, which is just about 6% of US adults experience generalized anxiety disorder at some point in their life. Now, we briefly mentioned kind of that difference between mild, moderate, and serious or severe, depending on how we look at this. And we see kind of the chunk of people we're experiencing in that moderate range. About 44% of people were experiencing anxiety that was kind of moderately impacting their world. And 32% were experiencing this on a very serious level, causing significant impairment to their daily lives. Now, let's also talk about depressive side. So we're talking about major depressive disorder. So the definition of this, it includes symptoms of depression most of the time for at least 2 weeks that typically interfere with one's ability to work, sleep, study, and eat. Now, what are the possible symptoms? Well, there's quite a few. So I just took a quick snapshot so that you might be able to get a picture of what this could feel like or could look like as well. So this could be persistent, sad, anxious, or empty mood, feeling of hopelessness or pessimism. Perhaps it's feeling irritable, frustration, or restless. Feelings of guilt, worthlessness, or helplessness. Maybe a loss of interest in things that normally are pleasurable. Decreased energy, fatigue, or feeling slowed down. Sometimes it impacts the concentration and ability to remember things, to make decisions, or be creative. Difficulty sleeping, early morning awakening is one of those symptoms that affect a lot of adults rather than children. Making decisions, difficulty with oversleeping, changes in appetite or unplanned weight gain, thoughts of suicide or suicidal ideation, aches, pains, headaches, cramps, digestive problems without a clear physical cause. And we can see that this really does impact quite a few people. Again, this data was taken from the year 2020, and it's looking at the overall statistic of 8.4% of people were experiencing major depressive disorder, with the highest percentage of that, again, coming from those who are in the 18 to 25 age range. We also see more prevalence in females than males, with 10.5 in comparison to 6.2%. Okay, why are we concerned about it? Especially if we're seeing numbers like 5% or 10%, we think, oh gosh, it's such a small percentage, but we're seeing this happen more and more. And I like to use some research to guide why we're concerned about this. So you'll see throughout this presentation that I first have pulled up the research study that we're gathering this information, and then I'm going to let that disappear so that we can kind of see maybe a take-home message from this. But the 2014 study from Chesney and Godwin and Basil said that people with mental illness have a reduced life expectancy of about 10 years when compared with the general population. And much of this reduction is attributed to an increased rate of cardiometabolic disease. So it's not always just that maybe inability to engage in physical activity. It's this cardiometabolic disease that we're experiencing in this population that is causing a substantial reduction in their life expectancy. And their symptom burden can drastically reduce quality and quantity of life. Now, what about sedentary behavior? In case that word is new to you, it just means physical inactivity. What happens when we're physically inactive? Well, we know that we have detrimental associations, which means it's a negative association with sedentary behavior with depression. So we see the risk of depression attributable to sedentary behavior was 31% higher over 13 cross-sectional studies and 14% higher over 11 prospective studies. So somewhere between this 14 to 31%, we see a significant increase in depression for those who are being inactive or have high sedentary behavior. So physical activity is so important to look at, and we want to answer this question today: is does physical activity make a meaningful difference? Well, can I just give you a spoiler alert right at the very beginning? I'm spoiling it right off the bat, and then I would love to go through some of the research of why. Spoiler alert, yes, Yes, it does. One bout of exercise can make a meaningful difference on energy, sense of pleasure, and positive affect, which is kind of, you can think of this more like excitability. We know that exercise can make a difference. We see this in research time and time and time and time and time again. We also see that engaging in exercise consistently can improve symptoms of depression in those who already have depression. And for those who have a really great mental health state, it has a protective effect in the future against depression. Let's talk about this more in detail. So we know that a 2019 study looked at the role of exercise in preventing and treating depression. Now, those are two separate things. We know that the first part, exercise provides protective effects on incident depression. That means maybe like a one bout of depression or kind of temporary depression. We know that exercise has that protective effect. It actually does something physiologically to help give us kind of an extra buffer to help our brain and our mental health as a whole. We also know that exercise can improve depressive symptoms for those who already have depression. Now, we know this is true. We know that similar to other treatments like antidepressive medications or therapy, we know that exercise, it's not effective and equal for all. It's not. So we know that there are some people who really tend to have a very profound response, and for those that don't. And I think it's just helpful to just be aware of where we have our benefits and where we also have our limitations. But the overall effect is widely in favor of exercise improving depressive symptoms in those with depression. And here's something that I think is a huge, wonderful takeaway, is that exercise at any intensity appears to be beneficial. Sometimes we think, oh, we have to be a marathoner or a triathlete or participate in CrossFit or something very high intensity to see benefits of exercise. And especially if you're experiencing depression, having a difficult time getting started or a difficult time overcoming some barriers, that can be so difficult to even start engaging with that type of behavior. But we know that at any intensity, exercise appears to be beneficial. So even just taking a walk or doing some mind-body exercises, doing some stretching, that can give some beneficial results as well. So continuing this study, I think they pointed out something very beautiful that I wanted to tell you today, is when we talk about exercise being effective at helping to treat and prevent depression, we have this common concern about dropout or difficulty with adhering to exercise. And we know that from the study that dropout from exercise interventions is comparable to dropout from other treatments for depression. So we're not seeing that those that some people are being, way more likely to follow through with other treatment options, and they're just really, dropping out at high rates from exercise. That's actually not true. We're seeing that comparable dropout rates from other treatments. And I think this is just helpful to know that we're seeing similar dropout rates from exercise in other clinical populations. So it's not that there's something hugely different or unexpected about this population. So using strategies to increase adherence, it's very important. And I would also add to this, just from personal experience, I think there's something very beneficial about creating a positive exercise environment early on, that we have a positive experience with exercise and we have strategies to help increase adherence. Now, this is a beautiful meta-analysis, and in case maybe reading research might be a little unfamiliar to you, a meta-analysis is a study that looks at lots of studies, pulls them all together, and then helps to identify clear patterns, associations, or results. So this meta-analysis did a beautiful job of looking at randomized control trials. It's the gold standard of the way that we want to evaluate research effectiveness or appropriateness. This is a fantastic study. So this study was looking at the acute effective response to physical activity in people with depression. Now, when they're looking at that acute response, we can think about that like a single bout of exercise, like a single exercise session, a single walk, a single workout. That's what they're looking at. What does one bout of exercise do in the body? So specifically looking at depression here. So the single exercise session was associated with a moderate, positive, effective response. What a home run here. And there's a low barrier to entry. There's no waiting time. There's nothing that is like difficult in terms of getting into exercise, we can see a moderate positive effective response in as simple as one session. What a positive thing. We also see from this study that both aerobic and anaerobic exercise improved mood states. For me as an exercise physiologist, what is the takeaway here for me is to say, woo, whatever we pick will help. So we get a lot of personal preference that we can use when we're talking about exercise. So we don't have to say, you have to ride your bike for this amount of minutes, or you have to do resistance training for this amount of time at this amount of intensity. We see that both resistance training and aerobic training or cardiovascular training, they were both equally effective at improving mood states. And one thing that we found out of this study I thought was interesting is that moving earlier in the day was associated with being happier and more energetic later in the day. So moving early, there's a component about moving early. We can pick an intensity that we want to, and we can also pick the type of exercise that we want to and still see really positive effects. Now let's look at anxiety instead. So we just briefly talked about depression. Let's talk about anxiety. So this study was looking at the effects of exercise on symptoms of anxiety in primary care patients. So this is not a meta-analysis where they looked at lots of studies. This is doing that direct randomized control trial in a primary care setting. So let's look at this just briefly. So we see the effects of different exercise intensities in the treatment of anxiety syndrome. So they wanted to do a control state. They wanted to have some people do low intensity exercise, and they wanted to have another group do higher intensity exercise. So what did they find? The results supported an exercise intensity trend for reduced anxiety symptoms. But the effect sizes were very similar in low and higher intensities. Again, we're seeing another, amount of data that supports this notion that the intensity is not as important. It's engaging with physical activity that's making a big difference. Now, these effects were independent of depressive symptoms. So sometimes we think, oh, well, maybe a patient or myself or someone I know or a friend of mine is experiencing anxiety, but they also have symptoms of depression. So they're experiencing kind of that 1-2 punch of difficulty. We're seeing in this particular study that anxiety was reduced, as well as with or without depressive symptoms. So I thought that was really encouraging to see. So we know that structured physical activity represents an effective treatment, and it should be more readily available, discussed more broadly, and talked about as a treatment option more effectively. This is looking at that same study, but we're just putting it in a visualized form. So let's first look at the green, blue, and red bars. So what we're looking at is their baseline, and then we're looking at, just right over from that, is their post-intervention. So we're seeing the control group is the green, the low intensity exercise group is the blue, and that red is the moderate to high intensity. Now let's look vertically. So we also see that if we're in that higher state, those people are experiencing severe anxiety. It's really crippling. It's really difficult to work through the symptoms. We also see moderate anxiety just a little ways down. We see mild anxiety a little bit lower, and then below that, we're seeing minimal anxiety. So it's kind of a way to interpret this. So when we're seeing both baseline to post-intervention, I want you to recognize the change. So we see with that control group, they are experiencing some symptom relief. So that is getting their usual treatment. So they're getting that usual treatment that we would typically get in a primary care setting. But if we add, so it's that additive effect of control plus low intensity and low intensity exercise, they're feeling even better with more of a symptom reduction in anxiety. And then for those who are doing even more difficult exercise, that moderate or high intensity exercise, they're seeing even more symptom reduction. What a gift. But we do know, look at the difference between the red and the blue bars in that post-intervention group. It's not that much different. It is better, but it's not that much better. So we do understand that it's really encouraging with low intensity exercise, moderate or high intensity exercise, we're seeing significant reduction in anxiety. I think that's so helpful. But now if we look at that same type of study, but we're looking with those that also have depressive symptoms, we're seeing such a similar trend. It's really encouraging to me to see such a similar trend with depressive symptoms. So we're seeing moderate, mild, and no depression, and that is just coming down with exercise. We're seeing that low intensity group definitely having a big drop because they start pretty high. And then we also see in that moderate and high intensity group, they're getting even more of a relief from their depressive symptoms. So I thought that was just really encouraging to see. So maybe what some of the take-home message here is that we can improve or manage symptoms of anxiety and depression with physical activity. Many feel better with that single session of exercise, and they can feel improvements in energy, which is a really big hallmark of those that are experiencing depression, is feeling kind of lethargic, low energy, or just helpless or hopeless. Feelings of pleasure is one of the benefits that we get with a single session of exercise, and that decreased state anxiety, feeling a little more calm, feeling a little more grounded, a little more comfortable in your body. Now, we also know that with exercise, we see this additional benefit of very little side effects, and we have no waiting period. You don't have to wait. You don't have to get on a list or a waiting list. You can immediately start exercising with very little negative side effects. We also see a moderate to large benefit in depressive symptoms in comparison to no treatment. And we think, why on earth would we compare it to no treatment? Don't we want people to get treatment? The answer to that is a big yes. But do you know that there is a big chunk of people who do not seek treatment for depression? Now, that is not what we want as the norm. We definitely want people to seek treatment for depression. But it's encouraging for those that may never seek treatment that we know that there is a moderate to large benefit in depressive symptoms. So that's really encouraging. Now, there's also a stigma around taking antidepressant medication, and I can just give this extra encouragement that for those who are taking antidepressant medication, adding exercise can give an even bigger difference. We don't have to pick between doing maybe therapy or medication or exercise. There's this beautiful additive benefit when we can combine exercise with the treatment that's recommended for that person. I find that just really beautiful. Now, I want you to kind of get yourself prepared to respond using the Q&A feature. So would you hop on that Q&A panel? I just want to ask you a question real quick. So can you think of a time when doing exercise, or maybe exercise in your past, had made you feel uncomfortable or temporarily anxious? Would you comment for me just by putting in yes if you have had an experience that made you uncomfortable or anxious, or no if you're like, nope, I'm feeling super good with my exercise? Would you comment yes or no in the chat box? And while you're doing that, so pop it in really quick. While you're doing that, I think it's helpful to know that not all exercise reduces anxiety. I think we feel this from our personal experience with exercise. Is I would love to sit and tell you every single type of exercise is helpful, every single kind of exercise, any experience is just going to help you feel so much better. But we know that's not true, right? Because some exercise can temporarily increase anxiety. So I don't know if you could think about maybe a competitive performance. If you participated in sports or did something competitive, those feelings right before that clock starts or that game starts or whatever it is, sometimes we can get a wave of those feelings of discomfort or maybe that temporary anxiety. If you've ever exercised when you feel like you're being evaluated, criticized, or judged in some way, oh, that's uncomfortable. Also, if you've ever tried something new or have been uncomfortable, I really don't have great like dance choreography skills. And doing something that has like a choreography component, even though exercise is my world and I love it, that gives me so much discomfort. I also know a lot of people experience body discomfort, maybe because of clothing that doesn't fit comfortably or something that we're seeing reflected in the mirror, doing some body checking in the mirror, that can cause some temporary anxiety. Activities with unrealistic expectations. Like if I were to say, okay, I need you all to run 1 mile in 4 minutes, like, oh, good luck. Like, no way. That can be very anxiety provoking. And also a change in health or injury status. If you had something you were able to do in the past, something has changed, now we're unable to do that or need a modification, that can really cause some discomfort with exercise. So I think we can think of some examples that we've experienced that might be indicative of times when we weren't feeling super comfortable with our exercise. So let's briefly talk about the type of physical activity that does not help us. Activities that you are shamed into doing. If someone is putting you in an environment where you feel shamed that you have to go participate in something, that does not help. Activities that are physically painful, that does not help as well. And I just want to make a quick note that we know that doing physical work and pain are not the same. So experiencing things like tension, pressure, stress, that is not the same as a pain response. So it's important to know the difference between that. But things that are painful or potentially causing harm absolutely does not help. So maybe activities that are just upsetting. So maybe doing something like large group fitness with being on the front row where you're being watched and evaluated. If you have social anxiety, that could be absolutely um, horrific. It could be really not helpful. And activities that are beyond your physical ability. These types of items are not helpful. So let's be clear, not all physical activity helps, but there is a type of physical activity that does make a difference. And let's talk about that. So I have questions. So my questions would be, what kind of movements should I do? How much do I have to do? How will it help me? And then I also think it's helpful to just maybe talk through or think through some concerns. Like maybe I don't feel well enough to move right now, or I don't enjoy exercise, or I don't have a starting spot. This can be a really common response when we're talking about our exercise. So let's start with a simple one. What should I do? Well, I'll give you a very, clear physical activity recommendation here in a moment, but let me just start with something so clear and simple. Is we want to start with the movement that you enjoy. And let's say, okay, I don't enjoy it. We want to start with something that feels tolerable. What can we tolerate today? What can we enjoy today? Maybe that's something as simple as taking a walk. Maybe it's something that has a positive association, like you really enjoy the water and want to go in like take a kayak out, or maybe that's too much emotional energy. And we just want to start with something like starting with a stationary bike. That's just the only thing you have to do is pedal right where you are. Something that feels tolerable or something that you could enjoy is a perfect starting spot. So if we talk about the minimum dose, we might say, well, how much do I have to do? We know that any exercise is better than none, even 1 minute. So if you have a 5-minute break at lunch and you think, oh gosh, well, 5 minutes is nothing, it doesn't really matter. My friend, it does. It does matter. It is worthwhile. So any exercise is better than none. And we also know it's this beautiful component for mental health that any intensity exercise seems to make a difference. So whether you enjoy working a bit harder or whether you enjoy just doing things that might bring you a bit more mind-body connection, we know that that can still make a beautiful difference. Now let's talk about some physical activity recommendations. So we know that there is a dose response to physical activity, that if we just do, the bare minimum, we might get kind of a bare minimum return. So let's talk about our physical activity recommendations. You can find this online at any time through the CDC, the Physical Activity Guidelines for Americans. We can see kind of this key guidelines for adults. Now, I just want to blow this up so that you might be able to see it a little bit better. We know that adults should move more and sit less throughout the day. Well, that's extremely easy to say if we're not dealing with additional things like mental health concerns, feeling anxious about maybe leaving the house, or maybe we're feeling like it's really difficult to get going at all. It's that helpless, hopeless feeling. That can be a very, very difficult way to start moving more and sitting less throughout the day. But we do know, again, that some physical activity is better than none. So adults who sit less and do any amount of moderate to vigorous physical activity, they gain health benefits, which is awesome. So anything you can do is a beautiful starting spot. And there's 3 bullet points here that I just wanted to bring into a different way of looking at it, simply to simplify it just a little bit. So we can think about the blue box and the orange box. So we want this and that. So here's the physical recommendation. The physical activity recommendation each week. The blue box, that's our aerobic exercise. That's when we're doing kind of those repetitive movements that are just going to help sustain our heart, our lungs, our blood vessels. It's so good for our muscular system. We want to do somewhere between 1 to 6 sessions per week. Now, we know the recommendation, I just put it right on top, is 2.5 hours of aerobic exercise a week. That might feel absolutely gigantic at first, especially if you're experiencing really difficult time getting started. But I also want to encourage you that if you were to line up all of the things that you need to do to care for your body that you're already doing, it would feel so shocking if you were using that as a starting spot. If you were to think, okay, we need to eat, 2-3 times a day, every single day. We need to, consistently brush our teeth the morning and the night. We need to shower. We need to bathe ourselves. We need to put clothes on and off. It could feel so overwhelming, but you're already tackling that and you're doing such a beautiful job at it. So sometimes it can be really difficult to hear the magnitude of it, but let's break this into more manageable chunks. So 2.5 hours of aerobic exercise is what we want to hit. Now, if you want to do that in one session, awesome. Or if you would like to break it up into more sessions, like 6 sessions, that's way more tolerable for most people. Somewhere between moderate and vigorous intensity is wonderful, but we do know that light intensity makes a difference with our mental health. Moderate to vigorous intensity is going to give us just overall general health benefits even more. And any type of aerobic activity works. I would be lying to you if I told you that you have to do biking, or you have to do hiking, or you have to do swimming, or you have to do whatever the thing is. It's up to your personal preference. As long as you're doing aerobic activity, you get to pick the type that you love best. I think that's a beautiful message. Now, for strength training, we know that we're trying to hit 2 sessions a week or more, but the bare minimum is 2 sessions. That's what we want to hit. Moderate or greater intensity is fantastic, and there's no predetermined time. That's kind of the beauty of a strength training piece. As long as we're hitting all major muscle groups and working on kind of that strength training component by doing a myriad of different ways, we'll talk about that in just a moment, you can hit that guideline. So that's what we're working on. And you think, okay, well, how will that actually help me? How does it really make a difference? Well, we know that I could write maybe 6 slides worth of really tiny font and go through every single benefit. I just wanted to highlight a few that I think might be interesting or important to you. So we see that exercise can help with decreasing that state anxiety, just temporarily making you feel better today, can give more energy today, can also help with memory and creativity, clarity of thought, helps us with longevity, helps us with independence, it helps manage pain, helps to decrease stress and give that outlet for stress. We also find this increase of pleasure. It can give us a sense of joy. And exercise can definitely help with self-confidence as we're feeling more strong, capable, competent. It really changes the way we see ourselves. Now, I also think it's helpful to know, why does it work? Is there a magic wand? Is there something magic that's happening when we're moving? Why is this making a difference? Let's talk about the proposed mechanisms really quick. I like to know the why behind the what, so I want to tell you that today. We know that exercise increases our blood flow because our heart starts beating faster in response to that need for more oxygen throughout our body. So as we're moving, our body responds by increasing our heart rate and increasing our blood pressure to help get that blood to those working tissues. We also know that we're getting that increased acute level, that means temporary, the levels of brain-derived neurotrophic factor. Now, BDNF is something that helps us with pain, with memory, with increased mood. And so as we get that kind of hit of BDNF, we start to feel a little bit better. We get that increase in our mood sensation. Now, exercise also helps us because it can improve our sleep. When we see those who are exercise consistently, it works a little bit better when we're exercising consistently rather than just a one-time deal. We see that our sleep starts to improve, especially if we're practicing some good sleep habits and good sleep hygiene with that as well. Now, with exercise, we're seeing that the prefrontal cortex and the temporal cortical region of the brain, they're stimulated during physical activity. They're getting more of that blood flow because our body's moving. Now, these regions, those 2 regions, are associated with regulating and experiencing mood. And we also, as we're exercising, we get this increased endocannabinoid circulation, which is awesome. So it's a family of lipids. It helps us with pain, it helps with mood, and it helps with memory. So we have some really significant things that are giving our brain a different environment and helping us practically to start feeling better. Now, we also know with exercise that we're seeing so many benefits throughout the whole body. So when our whole body starts to feel better, it can change our experiences and it can help to change and alter that mental state as well. So we're seeing improved cognitive function, cognitive just meaning the way that the mind is functioning. So we're seeing increased clarity of thought. So we might be better decision makers because we're using our brain that might give us more clarity of thought, can also give us more creativity so that we feel like we're solving problems and navigating our world with more tools in our tool belt. Can also help us with memory retrieval. Our exercise can help us to have an improved ability to fight infection. gosh, with the pandemic, I feel like we've really been talking about fighting infection and immune function. And we know that as we're moving, our body has a better ability to fight infection. We also see that exercise long term, not temporary, long term, helps to reduce our blood pressure and helps to reduce our resting heart rate. Our heart doesn't have to beat as hard or as fast to be able to supply our body with the oxygen that we need. Now we see improved cholesterol in the blood vessels. That's that circulatory pathway throughout our whole body. Kind of works like really fancy garden hoses to help supply our body. When we have those garden hoses that are more clear and they're not clogged up, gunked up, they surely work better. So exercise over time can help lower that negative cholesterol and actually helps to improve that cardioprotective, which just means it helps our heart work better, cholesterol that we have in our body. We also see improved insulin resistance and blood sugar. Often we talk about physical inactivity being associated with higher blood sugars, diabetes. We see a lot of the cascading effects, and that HbA1c is just that kind of 3-month average of our blood sugar over time. And we see that with exercise, it really starts to reduce that number because exercise serves as the mechanism to draw the sugar out of the blood, use it in our cells to either store it as glycogen or use it in our working muscle. Really awesome. We also see with exercise that we have improved markers of inflammation, and we know that chronic inflammation is such a strong predictor of future debility. So we love when we can reduce inflammation in the body. We also see improved body composition. So this is not a conversation about weight loss. This is a conversation about when we have working muscle that gives us more capabilities to do things with that throughout our day, lifting, carrying, doing things. We can explore the world around us in a better way. We might not have as much anxiety about feeling alone or requiring help because we might have more independence. It also helps with kind of that self-perception and the self-efficacy of what am I able to do? What am I confident and able to do? And it can really make a big difference. Exercise also helps with improved or maintained bone density, which is really wonderful because sometimes that feeling of potential falling or injury can be really difficult to navigate. And then we also have this piece, what we're talking about today is supporting mental health. We know that exercise is protective for anxiety and depression. But movement is wonderful, but it will look different for every single person. And we think about movement to support our mental well-being. We want to ask ourselves, what do I enjoy? What's important to me? What are my physical limitations that I'm working on? What is my history with physical activity? What do I have going on in my life and how can I practically make this happen? And then what do I have access to? What is surrounding me or around me that I might be able to tap into? So just a few things that I wanted to touch on about different environments that we exercise in. We can have different benefits because of it. So if we're at the gym, in our research, we're kind of seeing these recurring themes, that there's a physical touch component, there's acknowledgement and connection component, goal setting and achievement component, and then that new stimulus or excitability component. Now, with the physical touch component, this may or may not be something that you're interested in, which is perfectly fine. I have gone to the same gym forever and ever, and I actually love being able to walk in. Sometimes people will give me a high five, they'll give me a hug, give me a handshake. That physical touch component can just be really special, just knowing that you're a part of something. There's acknowledgement and connection. It can feel really good to have a connection together and know that people look forward to you coming. The cheers moment is, it's nice to go where everybody knows your name and they're glad you came. That can be a really wonderful thing about exercising at a gym. Now, goal setting and achievement can happen at any location, outside, indoors, out, at the gym, but you can start to see yourself differently, to feel competent and capable, like there's solutions coming, like you're working towards something. It gives you a bit of purpose, can help keep you on a schedule, and that can be really positive. And then also at the gym, you can have this feeling of having a new stimulus, something new and exciting sometimes can increase motivation. And we also see at home, there's also there's benefits there as well. And I think one of the biggest positives about exercising at home is the low barrier to entry. Sometimes if we're experiencing low or poor mental health, there can be a lot of emotional energy spent just navigating the environment. You have to park, you have to check in, you have to grab your stuff, you can't forget your shoes, you need to have your iPods charged, like all of these AirPods charged. Sorry, you can see how sometimes the emotional energy can be a really big barrier. So lowering that barrier by exercising at home can be something that's really helpful. We can also experience this lack of judgment. If you're by yourself at home, there's no one that would be criticizing you or evaluating you. And so that lack of performing can be really helpful as well. The accessibility at home is fabulous because it's always open. You never have to work on getting a key or navigating that in any way. But there's also so many benefits to exercising in nature. And I think we see this reported throughout the research so much, is that exercising in nature can give you a sense of contentment or peace. And often that's something that we're looking for. It can give us that appreciation of the beauty that's surrounding us, just the artistic beauty that we're seeing. It can boost our mood because we've changed the environment. We've walked outside, we've had to put shoes on, we had to do something different. And also keeping a schedule can be really helpful too. It can foster that mind-body connection. And I also think it can foster that connection with the bigger world around us, that we're connected to something bigger than us. And increased energy is one of the biggest things that we can experience in any environment that we choose to exercise. And also, exercise can be such a beautiful stress relief. But I think it's helpful to remember that we want to have some pleasure in our movement. If exercise only feels bad, negative, hard, painful, I think almost everyone on the planet would want to skip it. But we know that those who engage with exercise consistently can actually have a lot of pleasure because of the movement. So let's briefly just talk about some of the ways we could hit that first blue box of aerobic exercise. There's so many ways. It could be hiking, biking, swimming, rowing, elliptical, running, dancing, climbing stairs, any type of sport like pickleball, volleyball, tennis. These are repetitive movements that you want to do for like 2 minutes or more. So something that has a repetitive component of it, like walking, riding a bike, hiking, dancing, something that's repetitive. This will help us meet that cardiovascular component. The muscle strengthening component has so many options. And to be honest, I think sometimes it's difficult because there are so many options. We can work on our muscle strengthening with dumbbells, with resistance bands, with strength machines, with body weight exercises or cable machines. There's so many ways to hit our muscle strengthening exercise that sometimes I think that can be overwhelming. But most of the time, doing something like sets and reps with different types of exercise throughout the body, it's a really common way to do it. And we want to typically focus on the major muscle groups. So that would be our chest, our shoulders, our back, our biceps, our abdomen, thighs, legs, and calves. These would be our bigger muscle groups that we'd want to focus on, and it doesn't take a lot of time. So I think it would be irresponsible of me to just say, let's work on the bare minimum, because that might be a starting spot. But I think it's really helpful to know, what are we working towards so that we can reach some optimal health states. We know that working all of our major muscle groups 2 times a week, that is our goal. But as we're working towards that goal, sometimes it can be hard when we're so focused on the outcome of, I want to feel better, 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 which is the outcome, that it can really get us stuck in some ruminating thoughts. And if we're focused more on the process of, I'm going to get up today and I'm going to walk for 5 minutes, or I'm going to get up today and I'm going to bike for 10 minutes, or whatever that process is going to be more helpful than just focusing on the outcome. And I encourage you, whatever you have around you, start where you are, use what you can. If you have a trail outside your home, or a mailbox you could walk to, or a whole gym setup, or whatever you have access to, I just really encourage you, start where you are, use what you can. So some practical recommendations for our physical activity is to find what you like to do, or at least find a reasonable start. It doesn't have to be complicated to be effective. Actually, more simple is better. Start small as soon as possible. And maybe that start is as simple as doing 5 deep breaths and a 5-minute walk. And discuss your barriers to being active. We don't have to pretend that things aren't hard or that we don't have complications. We can be very honest and open about the things that are really challenging, even if it feels silly or small. So brainstorm those strategies in advance. If we're getting to the gym and forgetting a hair tie, and just that moment of feeling panicky or feeling overwhelmed causes us to turn around, Let's think about that in advance and just work through some things. It doesn't matter how big or how small, we can work through anything. Lower the emotional energy needed to participate. Lower that emotional energy. One of the reasons why exercisers who have been exercising successfully for so long are able to keep at it is because they have very low emotional energy that's needed. They are familiar with the environment. They know what's going on. They know who they're going to see. So it's low emotional energy. So don't be concerned if at first it takes a little bit higher emotional energy. Know that that's going to lower over time. Give yourself an opportunity to work through it. This is my dog, Charlotte, who brings me so much joy. Oh my goodness. So I just wanted to bring her in the presentation because she makes me smile. So I hope she makes you smile too. But I wanted to bring her into this presentation because it's helpful to have some social support, whether that is a friend, it might be a pet, just like my Charlotte, it might be a spouse or a loved one. Combining the positive social interactions and positive exercise experiences can be really helpful. So taking a friend or a pet on a walk can be just a really awesome way to get two things at once that can really help to support our mental health. And focus on incremental improvements. We do not expect perfection or for you to even be good at something that you haven't practiced. It's unrealistic. So just focus on incremental improvements and work towards the guidelines. Have a regular follow-up on your progress, because we know when we keep circling back to something, our attention and focus is on it, and it's going to help us stay engaged and motivated over time. And then to take your movement outside and engage in nature in some way. So I just wanted to put this back up just as that exercise prescription that we're working towards meeting the physical activity guidelines. This is what we're working towards as our ultimate goal. But I also wanted to just give you maybe a starting spot if this feels like a lot. So this is just a white pill that was kind of crushed up. And you can see on the left-hand side of the screen that you see kind of that bigger chunk of the dose. And then way over here, we see this really, really tiny component, or this little speck. And I'd like to call that like a microdose. So I'm stealing a term from something else and bringing it into my presentation today. So this might be something small like a microdose. This might be that simple starting spot that might feel manageable. Feel free to take a picture of this if it's helpful to you. But I just wanted to give you maybe that starting spot if you're working on making movement an important part of your day. So perhaps we recognize that we want to take one day off completely. I just need a breather to not do anything. That's healthy. But then we know that we want to incorporate just some movement, even if it's as simple as a 5-minute walk. We might do a 5-minute walk every day, Monday through Friday. And then on Saturday, we decide we just want to do a 10-minute walk, just to give us just a little bit more to work towards. And then for our strength exercise, we're not doing it at all, right? We're not starting by eating the entire elephant. We're just taking it one bite at a time. So maybe the first thing that we do is we just do two, a total of two, 1-2 upper body strength exercise. Maybe we just do something as simple as a bicep curl and something as simple as a shoulder press. Maybe that's the whole thing that we do that whole day. And we look at ourselves at the end of the day, we smile and we say, wow, I did what I said I was going to do. And that builds some confidence and it helps us feel good. Maybe we pick 2 stretches that we want to do if we're feeling like it. And that is an exceptional starting spot. Maybe on Wednesday, we just pick 2 lower body exercises. Maybe all we want to do is just to do a sit to stand up out of our chair and sit back down. Maybe we want to rise up on our tiptoes and do a calf raise. And that's it. We're saying that's it. We're going to celebrate that small start. This is a microdose, and I'm so just proud of anything that we can do to work towards meeting the guidelines. Now, this is just what it might look like to meet the guidelines. Maybe we build up over time to where we're able to do a 30-minute walk multiple times a week. We know that we're trying to get in 2.5 hours, so we're just doing 30-minute walk, 30-minute walk, 5 times a week. We can work towards that as a goal, even though we might be starting with that microdose and doing our upper and lower body strength training twice a week. That's all we need to do. Doing a little bit of stretching after that can help too. Example 3 is just another example of how you might get there. So this might just be another way that we can get there. If it feels overwhelming, don't start here. This is not a great place to start. So we want to move with any help that we can get. So you want to move alone if you want to. I love doing that. I love to exercise with a buddy, and I also love when I have help. I think it's really wonderful to just put yourself in an environment where you might be open to doing things in different ways. Now, let's say maybe you don't feel well enough to exercise right now. Can I tell you that there's a lot of people who really want to help? And I don't mean that in a weird patronizing way. I really mean that in a way that sometimes we can forget how many people are around us in our built environment who actually really do want help. So maybe this is something like calling a primary care doctor or a physical therapist. If you're struggling with heart or lung health, go to cardiac or pulmonary rehab. There's pain specialists to manage pain, psychologists or psychiatrists if you just need extra help, family members, orthopedic doctors, dietitians, therapists and counselors, spiritual care, friends, and then there's so many sleep specialists too that can make a big difference. This is not an exhaustive list. There's so many other people, but sometimes it's easy. We can feel isolated, like we're all alone, that there's no one who is really wanting to help support us. But I just want to remind you that that's not true. There's actually a lot of people who want help. Now, there's also limits to the benefits of exercise. We know that exercise is not the appropriate singular intervention when you're in a mental health crisis, or if someone you know is experiencing a crisis or experiencing suicidal ideation. I just want that to be really clear today, that we know there's a time and place for each intervention. And if someone's in a mental health crisis, I just really want to encourage you to be that advocate, either for yourself or for someone else, to call a crisis hotline. You can even text the crisis hotline. I think it's 988 that you can call or text to get immediate help and to speak with someone. And also, sometimes we just need to see someone in person and have that personal connection too. You can drive to the nearest emergency department and they're trained to help navigate through some of those really difficult things right away. So please know that exercise is so helpful, but there's limits. Now, also, is there an upper limit? Can you do too much exercise? Well, we know that if we do too much exercise too soon, we can get overuse injuries. We can also get some overtraining. So if exercise is feeling compulsive to you, where it feels like it's not something that you want to do or like to do, it feels like you something that you need to do and cannot navigate or cope without it, I really encourage you to talk to someone too, because there is an upper limit. And we know that law of diminishing returns is when we're kind of past that point of like all the benefits that we can get from a health perspective, it's about an hour and a half a day. Past that, we might be able to get sport performance, competitive performance advantages, but from a health perspective, about an hour and a half a day is just about tip top. Now, let's just go through a quick summary. We know that exercise has protective effects on mental health. We know that exercise can improve feelings of energy and pleasure. We know that exercise can reduce anxiety, both temporarily and long-term. However, we do have a caveat, right? Not all types of exercise reduce anxiety. We need to choose something that we feel competent, capable of doing, and then hopefully we have a really reasonable starting spot as well. Exercise can decrease symptoms of depression. For many, it's as effective as medication, but we know that we don't have to pick between exercise or something else. We can pick exercise and something else. So exercise is helpful alone, and it has that additive benefit when combined with other interventions. So seek other interventions as well. So we know that we want to keep our exercise simple. It's more likely that you'll stick with a simple plan, and complicated doesn't mean better. So thinking about, downloading the 12-week plan that's going to be, very complicated, very hard, especially if you're feeling overwhelmed, that's not where we want to start. You want to choose something simple, stick with that to start with. Reduce potential anxiety by having a set plan. It can be very overwhelming if we just think, oh, I'm just going to do all the things today. Oh, I'm feeling better, so I'm going to add this and do that. Add this, not helpful. Have a set plan, stick with that set plan. Aim for both the cardiovascular and the strength training components each week. Remember that any exercise is better than none. And the benefits of sticking with consistent exercise, it's profound. If you'd like to read through my references or see where I found some of this information, you're more than welcome to access that. And if you'd like to connect with me, I'd love to just say hi or even talk with you or see if there's anything I can do to help you. You can reach me. I work at Lifestyle Medicine in the Magic Valley, manage both the cardiac and the pulmonary side. This is my email address if you wanted to connect with me. And I'm happy to hear questions if we have time for them at this time.
Oh, thank you, Monique. Yes, we do have one question in the chat. Are there certain exercises that work better for anxiety?
Oh, great question. So, Sarah, what we know from the research is that some exercises that involve a component of deep breathing that give us some type of mind-body connection for anxiety can be a really healthy starting spot. So doing something that is typically slower in pace, like a yoga class or something like a Tai Chi session or something that involves some like deep diaphragmatic breathing can be really helpful in lowering state anxiety very quickly. And if you happen to be at home or in an office and need to activate some of that like parasympathetic response, that kind of slow down response in the body, doing some deep breathing with your eyes closed, breathing in through your nose and out through your mouth with kind of those closed lips, almost like you're breathing out of a straw, can really help to reduce anxiety in the moment.
That is an excellent answer. I like that. We also have, I think that's it for questions. I really appreciate the content, and I liked the tips, especially about starting small, really practical, easy ideas that will help someone get going.
Well, Sarah, thank you so much for having me today. I really appreciate this time together.
Thank you, and thanks to all our attendees. Have a great day.